Hi everybody, let's begin this week's unit on medical specialists. So I'll begin with some reminders for this week and also in the upcoming weeks. So worksheet is available based on this week's material. So this week's worksheet is on medical specialists. Please note the time that it must be submitted by and just to look forward. So we'll wrap up medical specialists this week and then you will have your break week. And after break week, test 2 will occur. Test 2 will be on prefixes. It'll include general knowledge of component parts, specifically how they're going to relate to this medical specialist lecture, and also just the general component parts, but parts of terms with emphasis on prefixes, of course, in particular. And also medical specialists. So the understanding of word parts that we've been practicing throughout the term will still remain relevant for this test, but there will be a focus, again, on prefixes and also medical specialists and what we cover this week. So this week's learning objectives include describing the major specialty areas of medicine, so the medical professionals and care providers that are within these areas, the combining forms that are related to each medical specialty, and you'll see that these are combining forms that we've commonly looked at and seen already, the type of units that are commonly found in the hospital environment, and associated common abbreviations. So abbreviations are often used in healthcare settings, so we will go over these abbreviations and what they stand for. So this slide gives us the big picture of how healthcare providers are organized. So before we look at specific specialties or roles, it's helpful to see the broader categories that make up the healthcare team. So we have physicians, who of course diagnose illnesses, provide medical and surgical management. We have nursing professionals who are essential for delivering ongoing patient care, coordination, monitoring, and patient support. We have our allied health practitioners, which is a very diverse group who support all of these facets. So diagnosis, treatment, rehabilitation, such as therapists, paramedics, and so forth. And then finally, technologists perform specialized technical procedures, operate essential diagnostic equipment. So these categories really work together within the healthcare system, and this is an aspect of the healthcare system that we are going to stress and focus on is the teamwork that is involved. So understanding the specific roles that each individual plays, but mainly how these roles come together to provide comprehensive care for patients. So healthcare is really never delivered by one individual. It's delivered by an interconnected team of professionals working together. Every patient encounter involves multiple providers who contribute in some capacity their different expertise. So each role within healthcare will have a unique scope of practice. So a specific role in assessment and treatment, different level and type of training. So for example, nurses, physicians, therapists, technicians are all trained differently and are responsible for different aspects of patient care, but their collaborative influence on a patient is extremely important. When team members clearly understand each other's role, consultations are appropriate and time effective, tasks are delegated safely, information is shared efficiently, and so this really reduces confusion and overlap. So knowing who does what is really important for effective communication and collaboration. Understanding roles, so role awareness will help professionals and patients navigate each care pathway. So when you understand the structure of the system as a patient, but also as a healthcare professional, you know where patients are going to begin receiving care, who they will see next, which specialists become involved or important at each stage of care. So this allows healthcare to become this very coordinated process rather than a random sequence of encounters. So ultimately, clear understanding of professional roles for all members of a healthcare team reduces everything from confusion to even errors, and supports better patient outcomes. So again, strong teamwork here isn't just helpful, but it's really essential, especially in modern healthcare today. So I'm going to play this video, and hopefully the sound transfers properly.
In an emergency, the first 15 minutes are critical to a patient's survival, but also their recovery. We assess, treat and transport patients to bring them the best possible care in the quickest possible time.
As a triage nurse, we assess you and prioritise your care in an emergency. We can start your treatment and make sure you're seen by the right people for your needs.
Every day is different for doctors working in the emergency department. We find out what's wrong, find the best treatment for you, and coordinate your care with the rest of the team.
As a part of your diagnosis, a test or scan may be required. Radiographers use imaging techniques to determine the next step for treatments. There's no need to worry. We let you know what to expect before we start and keep you calm during the process.
We usually being the first person that you see when you wake up and the last before you're going to sleep. Nurses are problem solvers, carers, innovators, educators, researchers, and leaders. And proud of it.
You might not realise, but pharmacists do a lot more than dispense medications. As part of your healthcare team, we ensure that you receive safe and effective medications to treat your pain and manage your symptoms.
As movement experts, we work with you to improve your function and your quality of life. Helping you get back on your feet is the most rewarding part of my job.
We're here to help with the personal and practical challenges when you or your family are unwell. Social workers do strategies to meet your social, cultural, and emotional needs during recovery.
We want you to be able to do the things you love and need to do, even if it's in a different way. We find solutions, whether it being making modifications to your environment or finding specific equipment for you to use.
Okay, so I have the link to this video present in the notes of the PowerPoint, and I'll also post it in the description of this video. But I love this video because it very nicely shows that continuum of care and multiple healthcare professionals who are involved in all aspects of the patient's care, but also their transition back home and going back to their normal life prior to an injury or to the effects of a disease or disorder, for example. So we are going to highlight today all of these healthcare providers that were seen in this video, along with others, and specifically their collaborative role in patient care. So we'll begin with physician education before we go into all of the different specialists. So just briefly, physician training is a very long but structured and highly standardized process across Canada and the United States and other countries. So it begins after high school with an undergraduate degree, which is usually focused on science or health foundations. After your bachelor's degree, you have to take a standardized test called the MCAT. This test must occur, and your scores take or play a role in your admission into medical school. During med school, students will learn everything from critical reasoning to anatomy, pharmacology, and patient care. After medical school, there are various licensing exams, and also after medical school, residency occurs. So residency is where the real specialization begins. So a particular individual will be matched to a certain residency program. They typically will rank or apply to the residency program that they are interested in based on specialty. So this could be surgery, pediatrics, emergency medicine, and so on. And this is really the immersive hands-on training inside hospitals. Training does occur during med school as well, of course, but residency is really where the specialization is occurring. After completing residency, some individuals complete fellowships for those who want to subspecialize. So, for example, a cardiologist can do a fellowship in interventional training, or internists can specialize in nephrology or oncology. So these fellowships allow for further specialization or knowledge attainment. And at the end, of course, obtaining particular licensure and certification to be able to practice. So it's a very long road. And there are various levels within the physician hierarchy, if you will. So a medical student is that individual who's enrolled in med school and working with, say, maybe another physician or working under a preceptor in a hospital. Now, an intern is an individual who has already completed medical school and is in their first year of residency. So a first-year resident is commonly referred to as an intern, and they will rotate through different hospital services and work under supervision and gradually over time gain responsibility. That resident is, again, a physician in training after medical school. So they train in a specific specialty such as internal medicine, neurology, or radiology, and responsibility will increase each year. So again, that resident is classified as a physician having completed medical school, but they're completing their residency and working under a fully accredited or credentialed attending physician. So the attending physician is someone who has completed their residency and is certified in their chosen specialty. They will supervise the work of the resident, also interns, and even medical students as well. And finally, the fellow is a physician pursuing post-residency training, so maybe in a more specific subspecialty area. So now that we understand kind of the training and the background of becoming a physician, let's talk about the different specializations and corresponding hospital units. If you walk into, different hospitals, you might notice that they don't all have the same units. So one hospital might have a trauma center and a cardiac surgery ICU. Another hospital may only have a general medical floor and a small emergency department. So the reason why every hospital is not built the same is because hospitals are designed to meet the needs of the population that they serve. They're not meant to be just identical to one another, but they're specific to community needs. So a hospital in a very small rural town doesn't need, a massive trauma or transplant unit if the population is small. And every single hospital in that area. It wouldn't see enough cases to justify it. Whereas a large academic teaching center, such as Sunnybrook Health Sciences, other Toronto hospitals serve a massive urban population, and it receives complex trauma cases from across the region. And so it makes sense for them to have specialized ICUs or trauma teams. Therefore, largely based on the area that the hospital is serving. So how many people live in the area, the age of the population is also really important. So an aging population will have very specific units that will cater to that. And even the types of problems that are common there, this can play a role. So healthcare systems are structured in levels, and there are community hospitals. So this will provide basic medical and surgical care. Regional hospitals will have more specialties involved. Children who need complex pediatric care will be referred to a hospital specific for that, such as the Hospital for Sick Children in Toronto, because that hospital is specifically designed for this level of care. So we centralize complex services instead of spreading them, basically. Now, this is really beneficial for resources and safety as well, something else I want to mention. So advanced units are going to require highly trained specialists, specialized nurses, advanced equipment. And if every hospital tried to run every type of unit, specialists would be spread way too thin. Staff would have even lower case volumes, if you will. So outcomes could worsen and costs would be a lot greater. So the way that this healthcare network is formed or spread allows for a more efficient system. And so basically, there are several different units in the hospital, and they will vary from hospital to hospital depending on the hospital's size, the population size, and the needs in that specific area. So in terms of the physicians and kind of the terminology aspect here, so ologists, as we've discussed previously, will deal with a class of disease, whereas Ishins will deal generally with a group of people or a specific population group. So let's look at that here. Now, this slide is showing primary versus acute care for various age groups. So we can see the use of Ishins in some areas here, and we will also, as we move on, see ologists and what they practice. So we'll start with the first one here, family practitioners, also referred to as general practitioners. They provide comprehensive care across the lifespan, really. So they can treat children, adults, older adults. This is just your classic family doctor. They'll manage both acute issues, of course, infections, and even they can and will manage chronic ongoing conditions like diabetes or high blood pressure. They're typically the first point of contact, right, in the healthcare system, coordinating referrals when needed. Now, geriatricians, we see Ishin here. Gero here, the beginning of this term, means old age. So geriatricians specialize in care for older adults, often those over the age of 70, 75. Their focus, though, while it is, of course, this particular age population, it typically involves more complexity because older patients often have multiple chronic conditions, take multiple medications, and have various other aspects such as mobility, memory, or functional concerns as well. So they're doctors that are trained to manage all of these factors together rather than treating each condition in isolation. Pediatricians, on the other hand, ped refers to children, are going to provide both long-term and acute care to children. So growth monitoring, developmental assessments, acute care for children as well. They specialize in how diseases may present differently in children compared to adults. So this is the key here, that particular diseases or illnesses may look differently as they occur in children versus older individuals. So they also can appreciate and understand and focus upon developmental stages, differences in medication dosing for children versus older individuals. So all these aspects are really important for proper care. Our emergency practitioners are doctors who work in emergency departments. So they will rapidly assess patients, stabilize life-threatening conditions, decide who needs to be admitted to the hospital or discharged or even referred elsewhere. So they're trained to manage a wide range of acute illnesses, of course, and injuries, often be presented with more limited initial information, so specialized in these more acute and rapid environments. Finally, an intensivist is a physician who specializes in the care of very critically ill or injured patients. So in terms of the relevant hospital units here, intensivists work in intensive care units, or the ICU. So these patients may require ventilators. A ventilator pushes oxygen into the lungs and helps remove carbon dioxide for the patient, reducing the work of breathing. So some individuals can't breathe on their own very well and require some help in this, so that's what a ventilator is going to do. A person may need a ventilator if they can't maintain adequate oxygen levels or can't breathe safely on their own. This could be due to various reasons, such as a traumatic brain injury, or ranging, to someone who is having severe, or had severe lung damage, for example. Individuals in the ICU really require advanced monitoring. They could be experiencing organ failure or uncontrolled diabetes. So intensivists are going to manage these complex, life-threatening conditions and coordinate a very multidisciplinary ICU team. Now, the geriatric unit, patients in this unit will be admitted for various reasons, but again, the main thing is that they are generally over the age of 75. Our emergency practitioners are going to work in the emergency department for trauma or acute emergencies, pediatric unit for a pediatrician or treating children, and general outpatient units or clinics are where you can find pediatricians, even family practitioners. Geriatricians may also work in outpatient settings as well. So outpatient referring to not in the hospital, but in clinics or community settings. Now, our surgical and diagnostic team often works behind the scenes or during acute interventions. So they don't always necessarily even, meet or chat with a particular patient, particularly in the case of a pathologist or in a radiologist setting. But they are providing really important aspects of patient care. And we'll start with anesthesiologists. So A, we know, means no as a prefix. And SO means sensation. So an anesthesiologist manages unconsciousness or no sensation during surgery and also post-operative pain too. So anesthesiologists will work mostly with patients undergoing surgery to ensure that they remain consciousness throughout. They're also included in managing pain afterwards, and they'll, throughout a procedure, monitor vital signs and ensure that patient remain stable under anesthesia. The pathologist is a physician who studies aspects of disease, right? Patho means disease. And specifically, they often work in a lab studying samples taken from patients, and they work to assist in the diagnosis and prognosis of disease. So even though patients, again, rarely see them directly, their role is extremely essential in confirming, for example, whether a mass is malignant, benign, say, infectious, if there's a cyst. So they are really responsible for studying and working to diagnose specific diseases or illnesses or abnormal growths. Radiologists, radio meaning X-ray, are going to specialize in imaging techniques, so study, diagnosis, and treatment of disease by interpreting imaging, such as X-rays, CT scans, MRIs, ultrasounds, used to diagnose disease. They may also guide procedures, such as image-guided biopsies. So they may play a role in specific imaging techniques as well, but they are extremely vital players in early detection of abnormal growths or of diseases and possibly further planning. So whether that be surgical planning or so forth. Now, for surgery, we'll talk about various surgeons throughout this lecture, but we'll begin by the distinction between general surgeon and field-specific surgeons. So a general surgeon is going to perform a broad range of surgical procedures, while field-specific surgeons will specialize in one body system, so such as cardiovascular surgery, neurosurgery. So specialization will allow for deeper expertise in complex procedures, whereas general surgeons will handle more general, not specific to a complex procedure of a given system. So a general surgeon may be involved in a variety of surgeries. The operating room is where the surgery will take place. So the surgical team will perform the procedure here. And after the procedure, a patient will go to the recovery room, which is where they will safely wake up from anesthesia. They'll be monitored for any complications by the team in this area. These general, like the surgical ward. So if a patient needs to stay overnight or longer after a surgery, they may be admitted here for continued monitoring, pain control, and recovery. So surgical units are specialized hospital wings where patients are admitted for ongoing care, possibly related to a surgical condition or to a complication. Now, day surgery is more for minor procedures, so patients tend to recover quickly or briefly and go home the same day in the day surgery unit. So together, this team specifically is going to be involved in surgical interventions, but also the diagnosis of diseases and conditions, whether that be by testing direct tissue samples or by examining images. So let's now look into kind of specific systems and the specialists that are involved in treating diseases of each system. So this slide in particular includes specialists that focus on the heart, blood vessels, and lungs as well. So while their areas do overlap to some extent, each specialist here has a very distinct role. So a cardiologist is a medical specialist who diagnoses and manages heart disease. So they'll treat conditions like coronary artery disease, heart failure, arrhythmias, so abnormal heart rhythms, and hypertension or high blood pressure. They can interpret those electrocardiograms that we've seen in previous lectures. They may order echocardiograms, so the ultrasounds of the heart, stress testing, so testing the cardiovascular function of the heart. And they can also perform some procedures as well. They primarily manage medical treatments though, but they'll also determine when surgical referral is necessary. Now, the cardiovascular surgeon, so pertaining to the heart and blood vessels, are going to perform open surgical procedures on the heart and major vessels. So this will include coronary artery bypass. So if a coronary artery is blocked, valve repair, so the replacement of one of the heart valves, for example, or the repairing of the heart valves, and any surgical correction of structural heart defects. So they will manage patients before and after major cardiac surgery and will really work closely with cardiologists for surgical decision making. Now, a vascular surgeon just focuses on blood vessels and treats diseases of blood vessels, mainly outside of the heart and brain. So this can include peripheral artery disease, so arteries in the periphery of the body, carotid artery disease, for example, so the carotid artery in the neck, any venous disorders, so disorders of the veins. They perform both open surgeries and more minimally invasive procedures to restore and to improve blood flow. So for these units, the cardiology unit is going to be the hospital unit where it's basically a step-down unit for patients who are improving but still need close monitoring for cardiovascular needs. So these patients may be more stable and not as critical, but they still need cardiac monitoring and frequent assessment. Now, the coronary care unit, or the CCU, is the highest level, or the cardiac ICU. So the CCU is for critically ill cardiac patients. So it's a very specialized intensive care unit for patients with more complex and unstable cardiac issues. This could include acute cardiac events such as a myocardial infarction or a heart attack, an MI, or open heart surgeries would be reasons for admission to the coronary care unit. So these are patients who are really unstable. So having an active heart attack, post cardiac surgery, recovery, like immediately. So they require continuous cardiac monitoring, very close care, and sometimes advanced life support. So that cardiology unit is just more the general step-down unit for patients who are improving afterward. Telemetry, however, is for stable patients who typically stable or more stable, and they require continuous heart rhythm monitoring. So for, things like post-cardiac procedure monitoring or arrhythmia evaluation, they may have been admitted to hospital for a slightly different reason, but are exhibiting some irregular heart rate or even being evaluated for an arrhythmia. So they would be admitted to the telemetry unit where their heart rhythm would be monitored. Of course, the operating room would be involved in any of these surgical procedures, and recovery room. Now, let's look over to the right side here. So at the top, we have hematologists. They are going to specialize in disorders of the blood and also bone marrow, which is where blood cells are produced. So heme, refers to blood. They diagnose and manage conditions like anemia, which we've talked about, clotting disorders, leukemia, so they will be involved in addition to oncologists, who we'll talk about later, but even cancerous blood disorders, a hematologist would be involved in that diagnosis. So their work often involves interpreting complex blood tests, even bone marrow biopsies, managing long-term medical therapies, so therapies for given blood disorders. They will be involved in that. A pulmonologist focuses on diseases of the lungs and respiratory system. Another name for a pulmonologist is a respirologist. They manage chronic conditions like asthma, COPD, or obstructive pulmonary disorder, so as well as acute issues such as pneumonia or pulmonary embolism even. So this could be infection-based, or a pulmonary embolism is a blood clot in the lung. But chronic obstructive pulmonary disorder, or COPD, is a very common disorder associated with various things like long-term smoking. Smoking is one of the main causes of COPD, and pulmonologists are going to be involved in the treatment of these. They also perform procedures like bronchoscopies. We've seen this term before. So, using a procedure to view the bronchi, overseeing ventilator management in collaboration with critical care teams. So basically, disorders and diseases of the lungs and respiratory system. And the thoracic surgeon is going to perform the surgical procedures on organs within the chest cavity, primarily the lungs, even esophagus as well. So they will treat or be involved in surgeries for lung cancer, so removing a mass of the lung, severe infections they'll be involved in, chest trauma even, or structural abnormalities. Excuse me. So unlike cardiovascular surgeons, they typically don't operate on the heart itself because that is performed by those who are more specialized in that area. But a thoracic surgeon will be more associated with the lungs and esophagus. So given these various specialists that we've talked about so far and these specific hospital units, we can start to ask ourselves some questions about, when would a particular individual see each specialist and what hospital units might they be admitted to, or will they pass through during their care. So if I were to provide you with a given case, we can think about or ponder what specialists might be involved. So in this example, a 72-year-old patient arrives to the ER with severe chest pain, shortness of breath, an abnormal ECG, and elevated cardiac enzymes. Coronated angiography confirms a blocked coronary artery, and surgery is required. So based on this case, what specialists would likely be involved in the care and treatment of this given patient? So I encourage you to pause the video, analyze the case, and based on the information that's been given and based on what we now know about certain specialists and what they treat, which specialists might be involved in this case. So I encourage you to pause the video and see which specialists you can come up with who might be involved. Okay, so hopefully you paused the video there. Now let's kind of take up this first question here. So 72-year-old patient arrives to the ER. So first we're in this emergency phase, right? At this phase, the patient will likely be seen by the emergency room nurses, so the triage nurses who first assess the patient as they arrive, perhaps, or if they were brought in by paramedics, they may have bypassed the triage nurses and were brought right into the emergency room, and they'll be seen by an emergency room physician and the emergency nurses. Now, it also indicates that the individual is having severe chest pain, shortness of breath, and they later find out that the patient has an abnormal heart rhythm. So the ECG is going to show their rhythm, and blood work would have confirmed elevated cardiac enzymes. So after performing blood work, the results can show tests for cardiac enzymes. So these are enzymes that are produced when the heart is in an abnormal state, or if something is occurring to the heart itself. So a specific disease state. These enzymes get produced, suggesting damage to the heart. So the other individuals who may be involved in this care after initial evaluation by an emergency doctor are cardiologists, right? So a cardiologist may come and evaluate the blood work that was performed, the ECG, possibly a respiratory therapist who we'll talk about in a little bit later on. But if oxygen support is needed, respiratory therapists are involved in this. Now, for the diagnostic phase, right? So we mentioned that an ECG was done, also a coronary angiography. So for any diagnostic imaging, sometimes a cardiologist may, read the results of this, but also radiology may be involved in supporting interpretation. if needed. So the radiologists can interpret imaging and provide support for that if necessary. Now, we also see surgery is required. So if surgery is required, that cardiovascular or cardiac surgeon can perform coronary artery bypass. So coronary artery is blocked, then a procedure can be performed to bypass that blocked artery to be able to provide blood flow to the heart in the area that is not receiving blood flow because of the blockage. So coronary artery bypass allows for the bypassing of that blocked artery to bring blood to that area. As well, with surgery, of course, operating room nurses are going to be involved, any technologists that are needed in the surgery. So we can see that in this already short process, many healthcare professionals will be involved in the care of this patient. Now, after the surgery, post-operatively, monitoring maybe in the cardiology unit, depending on the severity, maybe in the CCU. Pharmacists will be involved, of course, in any medications that are necessary for this patient. So in terms of hospital units, we saw emergency room, operating room, recovery room, maybe cardiology unit. So we can see that the process of treating a given case and a given patient is very collaborative, involves a lot of communication and coordination of care between various specialists and other members of the healthcare team, from nurses to technologists and so forth.